Good morning. It's Friday, July 27th, and I'm talking to you from Madison. This is the preparation for the work week of July the 30th for the Nursing and Health Informatics course at the University of Wisconsin-Madison. This week we're going to focus our attention on nursing information systems, particularly electronic health records. There's a lot of really interesting reading going on, but I will emphasize that this is the culmination in synthetic week. So although it looks like there's a lot of things to read, remember that you've been working with this material now for almost a month. My notes are on to the left of me, so you'll see me switching back and forth to follow them. This week we're going to be looking at four chapters and two articles. The articles from Maastricht include the chapter 12 on the systems design lifecycle, chapters 16 and 17 that address meaningful use in electronic health records, and chapter 22 that addresses patient safety and the informatics infrastructure for it. I'm also having you read two articles from the New England Journal by Mandel and Kohani. So now let me put all of this in some kind of coherent shape for you. When you begin to focus on the clinical information flow, we begin to think almost immediately about documentation. But I want you to think about electronic health records as being more than purposes for documentation, tools for documentation. And in fact, as you're thinking about electronic health records, I want you to think very hard about what else can they do for nursing besides serving as electronic repositories for clinical observation. Begin by looking over figure 4-1. This is the figure that your text refers to often, the knowledge cycle of nursing informatics. And try to locate where you are in this process. So we have a base of data, and we have these three funnels of knowledge development, knowledge synthesis, and knowledge utilization. And I want you to be thinking about that feedback cycle also as a type of a way of interplay between the knowledge flow and nursing. But remember, nursing information management includes the things that are professional nursing in their orientation, as well as the things that nurses do. Now, I've been talking to you about the four pillars of informatics: data and vocabulary, information and computer sciences, technology, and humans. And those four pillars essentially provide an orthogonal view on this structure, the flow of nursing knowledge, as Maastricht presents it here. So you should be thinking about what does language and vocabulary do to help formalize the data that flows through the system? How do computer information science help us to understand things like decision logics or algorithms, or how computer systems operate in terms of storage and retrieval processes? How our technologies, whether they be iPads or smartphones or electronic health records, electronic computers and with browsers, provide us with access to information and the ability to capture information. And finally, how do we as humans, our colleagues and our patients, use this information? Now, in chapter 17, we're focusing a lot on the electronic health record. This is the chapter that was developed by Emily Berry, and remember, she's going to be speaking to our class this week. Emily begins with offering a description of what an electronic health record is, and she provides a nice background for the research that supports the usefulness of electronic health records, as well as the policies that enabled it to happen. Now, electronic health records really aren't all that new. In fact, they were first proposed back in the 40s at Kaiser Permanente when they were collected on these massive computers using punch cards. The electronic health record of today and the electronic health record of the 40s are operationally different, but they're not functionally all that much different. They're designed to manage the clinical information available for care, to generate knowledge from or bring knowledge to the clinical practice setting through, for example, decision support systems, help us understand public health priorities and public health problems, and finally ensure the safe delivery of care services. So Emily talks about the components as they are presented, and she stresses in particular that we moved for 25 years from the idea that electronic health records were a good idea to finding federal levers or federal incentive programs for them. The two that you're most familiar with, or you've probably heard in conversation, are meaningful use, which is a financial incentive, and ACA, the Accountable Care Act, which provides the legal framework to ensure that care continuity occurs and the information technologies are available to support it. Now, as Emily goes through her research, she identifies that there really have been benefits from electronic health records, and they've been shown largely to be a stabilization of care and an assurance that the proper care is given and improper care is not given. So electronic health records really serve as very good organizers to ensure that the resources of the healthcare delivery system are used in a proper way for the patient. There's some question as to whether or not they've actually been cost effective, because in part, sometimes electronic health records reveal that people are being underserved, and so more care services are acquired or desired for them. Now, for those of you who work in hospitals, I want you to think about, where does your hospital fit on the HIMSS, HIMSS, stages of implementation. Most hospitals, Emily says, are between 0 and 3. They're just beginning to get started. They have a little bit of documentation system, a little bit of clinical decision support. Further on, some hospitals have reached level 7, stage 7, where they have fully functional clinical information systems. A fully functional clinical information system has 8 things, and let me read them to you. Health information and data, which is what we often think of as the electronic health record part. Results management, that is, results can be distributed in where they need to be, laboratory results, for example. Order entry management, decision support, electronic communication and connectivity, patient support, administrative processes, and reporting and population health management. These 8 features were advanced by the Institute of Medicine now almost 10 years ago as what are the key characteristics of an electronic health record. Emily describes for you that now the federal government has stepped in to actually put certification systems in place so that institutions whose electronic health records meet some or all of these 8 criteria become eligible for the incentive payments under meaningful use, but they still have to demonstrate that there is meaningful use of health information technology in their institution. At the end of the chapter 17, Emily begins to introduce you to the idea of cloud computing, and I think actually it's in a call-out box that Ida Andrewich wrote, called cloudy EHRs. Now, cloudy EHRs is kind of a catchy little phrase of suggesting that electronic health records might live in the cloud. We've heard a lot about the cloud in commercial conversation now, in the Amazon cloud. Cloud is just a reference to a large-scale data repository, lots of servers that exist somewhere outside of the institutions. Up until 2 years ago, clinical information systems were completely housed within one institution. Now, the cost of maintaining the hardware and, frankly, the redundancy that's required it actually hits every institution in a very complicated way. But if there were to be safe central storage, sort of like a bank, where health data from an institution could be stored remotely and managed safely in a remote way, it might be more efficient to implement clinical information systems. So the idea of electronic health records in the cloud is becoming more acceptable. This means that the institution essentially has a virtual extension of itself into a set of servers that don't exist up in the heavens, but might exist in Michigan or in a place like Nevada, where there's now companies whose only business is to store these large servers, so that different institutions, and in our case healthcare or research institutions, have a safe place to store their data. It reduces the demand on an individual system to actually have direct access to their own set of servers and their own technical support, and gives them more access to a general purpose server. Now, after you've read chapters 12, 16, and 17, take a look at chapter 22, because that introduces you to some of the reasons why we want electronic health records. We want to create a culture of safety. And in chapter 22, you'll be introduced in more depth to things like computerized provider order entry, which is quite important to those of you who will have prescriptive authority as advanced practice nurses, and also to barcode administration management systems. A word about chapter 12 before we go too far. In the systems development lifecycle, you will see an introduction and a reference to concepts that you've already become a little bit familiar with. What's important about chapter 12, particularly for those of you who are doing a option 2 in your semester project and are designing an iPad application, is that there are some design strategies that are offered in chapter 12 that will be useful to you. So if you're looking at option 2, the iPad application or evaluation, chapters 12 and 14 in the textbook are going to be particularly helpful for you. They provide you with some structure to carry out the methods. Now, chapter 12 also introduces you to some ideas that you may begin to have a feel for, but you haven't put words on. Jessica Branson mentioned the other day that she didn't like that article that we read by Liam Bakken, because they use PDAs to create a clinical decision tool for the nurse practitioners, but then the nurse practitioners had to use the PDA as a information source, and then they had to transcribe that information into the clinical record. There was no connectivity. That's where the concept of interoperability comes in. In Chapter 12, you'll also get reacquainted with the concepts of open source that we talked about earlier in this semester. Now, with the completion of Chapters 12, 16, 17, and 22, you've covered the basic materials in the textbook that describe information systems, beginning with language and vocabulary that we spoke about actually only 3.5 weeks ago. But language and vocabulary through patient use of information, generating and using evidence in practice, looking at specialty systems, and now looking at a composite EHR. So we've built up the electronic infrastructure for clinical nursing practice. I'm introducing you to the Mandel and Kohani articles now because they bring a vision of the electronic health information systems of the future. Mandel and Kohani have said for years that data should be accessible wherever it's needed, whether it's in the patient's hands, a public health authority, a clinical practitioner, someone who's caring for the patient after they've had surgery. Data should be flowing freely. And now they're arguing for a concept of clinical records in their 2012 article. They want a concept of clinical records not as you see Emily Berry's description, not as this shrink-wrapped one product producing all 8 elements, but rather as a system of applications running over a large system of data so that the clinical information available to individuals is accessible, meaningful, and the applications help it to be sharpened, brought into focus for practice, and made understandable by whether it's a clinician, a patient, a public health authority, or a researcher looking at it. I hope you've enjoyed the textbook. I hope it's been useful to you. There are a couple of the chapters we'll be reviewing, and please be ready with your questions for Emily. I'm going to see how the discussion goes on Tuesday evening. If the discussion with Emily is going well, I'm not going to have us go into small groups for the second half of the class. If it's going slowly, we will break into small groups. And if you have an opinion about that, please let me know as soon as you can. Now, to finish up this video this morning, I'm going to talk about the 2 projects that are still on the burners for those of you who are working on them. So let me switch my slides here for a minute. Field project number 2 is due on Monday morning at 7. It's due at 7 a.m. for a couple of reasons. I don't want you to spend too much time on it, frankly, and so making it due early in the morning will mean that you get it done before you go to work or before your day starts. Field project number 2 links well with the material we're reading right now because it is a visceral experience of some of the concepts that Emily talks about in chapter 16 and 17. In field project number 2, you're to be writing a small, short paper, 3 to 5 pages, that's a report. Now, this is different than the advocacy paper in field project number 1. This paper is simply a report, and you should be covering 4 key things. First of all, what are the key features of the information system that you're looking at? Some of you look broadly at all of EPIC. Some of you look very specifically at a particular information tool that did one thing, and that was the CPM system that someone brought to my attention. I want to hear the assessment of the clinician's perspective of the impact of that information system on their work. And that comes both with looking at the size instrument as well as looking at the usability criteria. You should be paying particular attention, and I do want you to mention the ability of the information system to provide decision support, the use of formal technologies, and the sense of usability. So you have a paper that's going to address 4 things: the structure of the information system, its impact on the clinician, and its particular attention to the informatics consideration of decision support, vocabulary, and terminology, usability, and nursing impact. The final component of this is as was in the first paper, to make sure you address this in a way that is consistent with the professional method of providing papers, which would be the APA format in our parlance here. Now, some of the students have asked me to review what's required for the semester project. You should be well into your semester project by this point in time. And if you have questions, please send me an email. I'll do my best to get back to you as quickly as I can. Remember that each student is going to be preparing a 12-slide PowerPoint electronic poster. You'll upload your posters into the Dropbox by August the 2nd at 5 p.m. Each student will take care of creating a poster that summarizes their work and uploading it into the Dropbox. Then from 5 o'clock on Thursday afternoon until 7 o'clock on Monday morning, August the 6th. Each student will be asked to review and evaluate 4 to 5 posters. Your evaluation tool will be presented to you in a quiz form that will be available on the Learn at UW website. You simply log in, you'll be shown 4 or 5 quizzes. That's your assessment of the poster. You review the poster and then you complete the answers to the quiz. We're using a quiz format not because we're testing you on what your classmates have done, but because it gives us an easy way to compile the information. There is an electronic poster assessment form. We reviewed it last evening. It's also available on the class website in the left-hand list and also in the materials for this week. You're asked to evaluate the posters based on 4 criteria: appearance, abstract, content, and the relevance or the importance of putting this poster into our poster extravaganza for next Tuesday night, August the 7th. I'm asking you to look at the posters and make judgments about whether the abstract, the appearance, and the content are not adequate, or really superlative, superior. Each poster will have a slightly different feel because people's projects are pretty unique, but in general, all the posters should have some way of helping you understand what was the purpose of this project, what motivated it or what was the background, what methods did the group follow, what results did they get, and what conclusions or discussion do they present. So although there might not be those titles on each different pages of the poster, you should come away with a feeling that you know all of that. Students who are using option 1 will be reporting on the development of the informatics infrastructure for their scholarly project. Now, some students are farther along in their scholarly projects than others, so not everybody's poster will look the same for this. The methods should report what you did to build that infrastructure, not what you will do, but what you've actually done, and show us some evidence of this. For example, if you created a database or an e-portfolio or an Excel spreadsheet to keep track of your information, we should see that in your poster. Students who selected option 2 and developed an iPad app, please show us sample screens and tell us how you demonstrated its use. Maybe you showed it to some classmates, maybe you took it into work. You should describe why it was built and the process that you used to build it. Students who are evaluating an existing iPad application should describe how you selected it, why it was important, address particularly the informatics issues about data security, for example, or language standards, and finally, give us your evidence that it was adequate. Maybe you conducted a small study or a survey. Maybe you took it into work. I hope you have a good time with these projects. I hope you're enjoying the class. I hope some of you are having some fun some days, and most of you are having some fun most days. Thanks very much, and I'll see you on Tuesday evening at 5 o'clock. Bye now.